we need them. We do. We need those strategies. Those strategies for living, that is. You ready? You ready for your daily dose? Your daily dose of radio rehab?
I'm ready.
You ready?
Now I am.
Okay. It took you a minute, huh?
It's taken me a few seconds to warm up here
Yeah,
today.
well,
You know,
yeah, it
It's
takes
one of those days.
takes you a little longer, but you look so much better than I do once you get ready.
I
you
don't
know?
know about that.
Well, I mean,
a little biased.
all people have to do is look on the radio and they can see it.
Oh, sure. Yeah.
I mean, it's so evident, right?
Mm-hmm.
Hey, folks, welcome. Welcome into 1017 FM and 710 Keo. Welcome into another edition of Strategies for Living. I'm Dr. David McMillan, and she is psychotherapist, PLPC, Lauren Leon McMillan, and we're venturing into a major area for you this evening.
For me.
Yeah, I'm depressed about it.
Well, yeah, I can understand.
Yeah. Well, I think every so often we have to talk about the things that are impactful and actually affect all of us. And one of those things is depression. Depression is the most common and serious mental health disorder that negatively affects people. It affects people in all aspects. It affects us how we think. It affects us how we feel, and
Mind, body, and spirit.
Yeah, and it affects us how we act. And it's this feeling, this persistent feeling of sadness, a lack of interest in activities that you once enjoyed. 280 million people across the world suffer from depression, according to the World Health Organization. And that's a lot of folks. Mm-hmm. But you say, okay, well, that's the world. Well, in the United States, 21 million Americans every year are depressed. That's 8% of our population. And if you really want to get serious about it, let's look at our youth. 15% of youth, 3.7 million 12 to 17-year-olds suffer from depression. This is something that we got to talk about.
Yeah.
Because it's
pervasive.
It's pervasive, and it's got an impact on society. I mean, it affects individuals, but it also affects families, and it affects communities, and it affects economies. Mm-hmm. And it leads to decreased productivity, increased healthcare cost, and certainly significant societal changes. So we got to talk about it every so often, and guess what? Today's the day.
Today's the day.
Today's the day. So,
right.
Folks, thank you. Thank you for tuning in and being with us here on Strategies for Living. We are glad. We're not depressed about you being with us at all. We're glad you're with us. And we're also glad that our sponsors make Strategies for Living possible. The Robinson Film Center and Azalea Cleaners and Learning RX and Pintail Roofing and the Balanced Life Wellness Center. Back in a moment. We are talking about depression today, right here on Strategies. Come back and join us. Dealing with stress, pain, feel like you're running out of options? When your life is balanced, wellness is a given. True wellness is holistic. It's about the mind, the body, and the spirit, all in balance. Now, there's a place right here in Shreveport that's all about helping us achieve peak mental, emotional, and physical health. The Balanced Life, 117 Kings Highway, right next door to Strawn's. Come see and feel the difference getting your life in balance can be. Many of your friends and neighbors have already learned the difference less stress and pain mean in their lives. You can book a discovery session right now online, thebalancedlife.us. All you've got to lose is stress, pain, or maybe both. Come see and feel for yourself the real difference balanced wellness makes. The Balanced Life Wellness Center, 117 Kings Highway in Shreveport, next door to Strawn's, thebalancedlife.us. And welcome into Strategies for Living, helping us live healthier, happier, more peaceful lives in our bodies, in our minds, in our spirits, in our relationships. Here on Strategies on 101.7 FM, 710 Keel. Lauren Leon McMillan, David McMillan. And you know, depression, it's more than just a feeling. It's more than a feeling of sadness. It is a complex mental health condition. It affects millions across the world. And, 280 million, that's a lot of folks across the world, but it affects a lot of us. You know, we've got so much going here in the United States, and it's living in America. Everybody wants to be here, right? And yet 21 million Americans every year suffer from depression. Right. That's a lot. That's a lot of folks.
It is. And I hate to say it, but I mean, if you look around, you can kind of understand why the chaos that's going on in the world, especially right now, right?
Yeah. We deal with a lot. And, what we've got to, I think, you have to be able to address something. You've got to have an understanding of it.
Well, you've got to be able to recognize it and name it and be aware of it.
Yeah,
in order to change anything.
Yeah, we can't heal what we don't understand, and that's why, so every so often we take and we talk about topics that are like depression. Yes, it's serious, it's heavy, but it's important. Mm-hmm. It's important that we talk about it. So let's talk about some of the aspects, because when we begin to look at depression, we've got to look at biology. We've also got to look at psychology, right? Because there are biological and psychological aspects.
Right.
The depression is associated with certainly some neurological changes, some changes in our brain, right?
Yes. Yeah, there are several prevailing theories of thought for the way, there's the neurological basis of depression.
Right.
One, of course, is the depletion of monoamines, which is what we really all actually know about. I know that's a mouthful, but we all are actually aware of it and talk about it because it's the depletion of serotonin and dopamine and norepinephrine.
Right.
And so that's one theory. Another theory is the idea that it has to do with the connections between structures in the brain.
Right.
Right, especially that hypothalamus and your amygdala, which is the center for your emotions, and the hippocampus, which is the center mainly for your memories.
Okay.
So there's those two, and I believe...
And then there's the balance theory, in specifically the imbalance, that there's imbalance in the neurotransmitters like serotonin and dopamine and that type of thing.
That's the monoamine depletion theory. The other one that I was forgetting was about inflammation. Inflammation in the brain is another theory. Now, for me, and, I have heavy background in neuroscience and psychology both together.
Yes, you do.
And so for me, I wondered, I came from very heavy, it's clearly in the science, but now I've also experienced the psychological and counseling and the real world side of it. And for me, it really comes to me as, where is it, the chicken or the egg?
Yeah.
Right?
Yeah.
Surely, obviously, there are some neurological changes that happen in the brain with these issues, these disorders and diseases, and in particular depression.
Yeah.
We can see that. We can study that at least functionally in the MRI, right? We can tell changes by at least
you can see them in the brain. Right.
But for me, it becomes a question of, where does it start?
Yeah.
And where do we truly want to attack?
All right, and that leads to the question about genetics, right?
Yes.
Is there a genetic predisposition to depressions?
I think there's no question on that. Studies have shown over the years that, yes, there is a genetic predisposition. Now, again, I don't know how well we are able to tease out nature or nurture.
Right.
Right? Because genetics is, you would have to tease out adoptive families in that instance to really get to the source of. But there's no question that
we know
some influence.
Yeah, we know the studies indicate that individuals with a family history of the disorder of depression are something like 2 to 3 times more likely to develop depression, right?
Yes.
It's not just about life circumstances. I mean, we can't oversimplify. This is rooted. It's rooted deeply in both biology and psychology, right? Mm-hmm. And then there's the psychological theories. If we haven't complicated things enough, psychologically, there's a lot of theories that attempt to explain the depression's onset, right? Mm-hmm. Cognitive theories certainly, focus on the thought patterns. Oh, well, it's negative thought patterns. But then there's the psychodynamic theories.
Right.
Tell me about your mother.
Right, those unresolved conflicts.
Yeah, the internal
trauma.
conflicts or the trauma. And, I don't know, Lauren, I suspect that it's like in a lot of things in life, it's not one simple thing. Right. It can be both. We look for either or, but it can be both and.
In fact, I think in my experience, it is almost always both and.
Yeah.
Because we're multidimensional beings.
Yeah. I think it's so important to be able to understand and recognize the signs.
Yes.
Because that's the first step in addressing it.
And I think especially with this particular issue, because so many of us use it colloquially, just like you did at the beginning of the show, right? Well, I'm depressed. This makes me depressed.
Talking about depression makes me depressed. Yeah. But we got to do it. Yeah.
Yeah.
Yeah. And exactly. Right. Not exactly. And can I talk myself into depression?
Yeah.
Yeah.
They sure can.
I think you can. I think I've seen it over and over. Yeah. So, persistent sadness, lack of interest in previously enjoyed activities, changes in appetite, changes in sleep. Those are all symptoms that are looked at.
Yes.
But those vary. We could also include difficulty concentrating, fatigue. Those symptoms can vary widely across individuals, though, can't they?
Absolutely, yeah. And I think a lot of times, often in men, sometimes depression can masquerade as anger.
Oh, yeah.
That's what I've noticed so far.
I think you're 100% correct. I often talk about anger as being an umbrella emotion for men.
Right.
Okay, well, under the umbrella, what's under there? A lot of times hurt,
sadness.
And sadness. Yeah.
And fear.
And fear. Yeah, exactly. So, when you look at diagnosis,
yes.
Typically when these criteria that we're talking about, we're not just pulling them out of the air. These are identified in the DSM-5 or the ICD-11. Let's talk about what that is. DSM means Diagnostic and Statistical Manual, 5th edition now, right?
Yeah. Otherwise, sometimes referenced as the Psychotherapy Bible, right?
Yeah.
Psychology Bible.
Yep. And, when you look at DSM or you look at ICD, and ICD is on number 11 now, I think. And that's just, the ICD is like the international, right?
Right, Code of Diseases.
So
disorders.
There's a requirement of a certain number of symptoms to be present for at least 2 weeks. And the process also involves a practitioner like yourself who's trained in diagnostics, being able to rule in or rule out other medical conditions that could be causing this or driving this, right?
Right.
But there are challenges. There are challenges to making any kind of diagnosis.
I mean, again, it kind of goes back to the chicken or the egg issue, right?
Yeah.
And life is multifaceted. There are so many factors going on at once. Really the diagnosis just relies on the symptoms. If you've got these symptoms for this amount of time, then it's diagnosable.
But then there's the overlapping stuff, and I'm thinking particularly with depression about anxiety, and I'm thinking about how often that
it's almost inextricably that they're going to go together.
Yeah, when you see one, you see the other, right?
Yeah.
Yeah.
In fact, this is not always the case, but quite often what I've noticed has happened is, and it doesn't always go in this order, but this is a common occurrence, is that if someone really has struggled with anxiety for a long time, and if you attempt to mask it or mash it down,
right,
it's at that point that we switch to depression.
Right. There's one other thing, because so many people struggle with chronic medical conditions, right? And so whether that be chronic pain, whether that be managing diabetes, whether it be managing cardiovascular issues, there's a lot of things. I could go on and on.
Sure.
But there are... the United States, let's face it, we're not as healthy a nation physically
No.
as maybe we were, 30 years ago, 50 years ago. And so you got to be careful when you are making a diagnosis of what is this individual carrying in terms of medical conditions, because
Yes.
that takes its toll.
Absolutely.
Yeah. So we're talking depression today. We're going to come back. We're going to talk about impact on daily life, but we're also going to talk about some things that are commonly done. Most important, we're going to get to
strategies.
Yeah, strategies, an awareness. What can you look for? What do you need to be aware of? What are the strategies? Because after all, we are strategies for living, and around here we take growth very seriously here on Strategies for Living, and we want us all to create the kind of life that makes you excited to get out of bed every morning and get after it. And when you're depressed, you just don't feel like that.
No.
Yeah.
Yep.
Talking about depression today on Strategies for Living. We'll be right back. You're going to see the difference. When you go to Azalea Cleaners, you'll hear about it too. Azalea Cleaners has been fine dry cleaning since 1958, plus laundry, alterations and repairs, comforters, wedding gown cleaning and restoration. You'll hear about it from your friends because they'll see it too. They'll notice the Azalea difference. Azalea is convenient. 732 Azalea Drive, 9220 Ellerby Road, and 9227 Mansfield Road. Plus, the front door of your home or business with Azalea's delivery on demand. Just text SETUP to 249-8283, and Azalea will pick up your clothes and deliver them back clean and fresh to you. You can't get closer than that. That's the Azalea difference. You'll notice it right away. Others will too. The Azalea difference. Fine dry cleaning since 1958. Text SETUP to 249-8283 and get the Azalea difference. AzaleaCleaners.com. And welcome back into 1017 FM, 710 Keel. Welcome back into Strategies for Living. We're working our resident psychotherapist very hard today.
I don't know about that.
She's just working her little fingers to the bone. Lauren Leon McMillan, PLPC, David McMillan. We're talking about depression today. When you think about the impact, so Lauren, you talk about relationships, you talk about work and productivity,
There is
you talk about physical health. Is one affected more than the other?
That would be dependent upon individual, but there's no area of life that it is not impact.
That it
At
doesn't
least,
touch.
yeah, on some level. I mean, it might not be as strong in one than the other. That totally depends on the individual and how it manifests.
Yeah. So what I'm hearing you say then is, okay, this is a mental health diagnosis, and yet depression is not confined to mental health. It permeates everything.
No, yeah, it knows no bounds.
Yeah.
For sure.
So it strains personal relationships because those affected might withdraw from loved ones. It might lead to misunderstandings. It might lead to weakened bonds between people, whether they are spouses or whether they're other family members, right?
Yes.
Yeah. In the workplace, depression can have a major impact because
sure, if you've lost interest and
you've
withdrawn, you're not going to enjoy or want to do as much work as you have.
So you're talking about reduced productivity, you're talking about absenteeism.
Yes.
In severe cases, we're talking about potential job loss, right? Yeah.
Yep.
So then there's the physical. The toll of depression on physical health, because, sufferers can experience a lot of pain, chronic pain, over a long period of time. What about the immune system? We talk a lot about the immune system. Does depression affect, if I'm dealing with depression, am I more likely and susceptible to get everything from the common cold to COVID to whatever else is out there that I can...
Absolutely. I mean, just as the name suggests, depression, right? It's going to depress everything, including the immune system. So it weakens your immune system and does make you more susceptible to whatever's out there, whatever you encounter.
So I think that's another reason that really understanding what we're talking about, understanding depression from the way we're talking about it this evening, and understanding the total impact on life, underscores really the importance of addressing it as a whole person, holistically.
Oh, absolutely, yeah. And I think this kind of speaks to the deep call that depression is. I mean, it's trying to get your attention from every angle. Hey, we need to do something.
Yeah.
Something is not not right.
I'm going to do something that's going to make you laugh. Okay? This is depression. It's a knock.
Right.
And it's a loud knock.
It's a loud knock, and if you ain't answering it, it's about to bust your door down.
Yeah.
I mean, that's the level that it can escalate to. And it does.
Now, one of the things that's interesting to me, I can remember being a kid working at the grocery store, right? And I'm thinking now of a particular family, right? Don't try to guess who this is. You won't.
Okay.
I'm not talking to you. I'm talking to anybody out there that might know me. But I remember as a kid, I don't know how many times I carried this lady's groceries out, right?
Okay.
And, it was, that was a long time ago. What was I, maybe 14, 15 years old, 16 years old, whatever I was, But I knew the lady was depressed, right? Mm-hmm. I knew the lady was depressed.
Yeah. It's an energy. You can feel it.
You can feel it.
It's
yeah,
pervasive.
And I did. I wouldn't have been able to discuss it like we're discussing it now, but I knew this lady was depressed. Unfortunately, she ended up taking her life. Mm-hmm. Okay, and because at a grocery store, you get to know not just one family member but other family members.
Yes.
I knew this lady's son, who also shopped, and you know where I'm going. It was obvious that he was struggling with it too.
Oh, sure.
And the same thing ended up happening,
Wow.
although it was many years later.
Right.
And other people on the outside would look in on this family and they would say, these people have it all.
Right.
You know?
Yeah.
They've
And
got...
never saw it coming. It doesn't make any sense from the outside.
Yeah. And so, I'm sharing this to underscore this is not about how much money you have in the bank,
No.
or how much land you have, or this is, or how happy people think you ought to be or should be.
Right.
Depression is once it grabs you, it's got you.
Yeah.
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 And so,
And it's a part of life at this point in our development as a society, I believe.
yeah.
I mean, if you haven't personally experienced depression, you have likely known someone or been close to someone who has.
Yeah.
I mean, with those numbers you mentioned, that makes sense.
Now, I'm going to get on my soapbox for a second.
Okay.
And, with no disrespect to any medical doctor, whether that medical doctor is an internal medicine doctor or a psychiatrist or a family doctor, because there are many, the fact is there are many medical specialties that attempt to help. And most doctors want to do that,
Sure.
whether they are internal medicine doctors or family doctors or psychiatrists. They want to help their patients.
Well, sure.
Yeah.
That's hopefully the reason they got into the career they're in, is to be a helper.
But here's where my soapbox comes in. And I think that managing depression effectively requires a combination of things.
Absolutely.
No disrespect to the medicines on the market that are available.
Well, it's just like we mentioned at the beginning about the factors involved. It's not just a physical disease.
Right. And
It's
I think,
much more.
I was talking to a psychiatrist back a few years ago, and we got into a conversation on depression, and this particular psychiatrist is not the only psychiatrist that said this to me. This physician said, the greatest psychiatrist cannot tell you why depression happens, and if we prescribe a medication, the greatest psychiatrist can't tell you why and how it works.
Right.
They just can't.
Right,
And
we can't even measure. I mean, we've got a little better in terms of knowing some DNA factors, but we
Right.
truly can't even know what will work for each individual.
Right.
I mean, it becomes quite the trial and error game.
So you've got a lot of SSRIs and other the SSRI means selective serotonin reuptake inhibitors.
Yes.
And so the theory is that by adding the serotonin reuptake into
it keeps the serotonin out in the synapse longer, which
Right.
gives you a bigger boost of serotonin.
That's the theory
Yes.
anyway, and it's a theory.
Right,
It's a
we
theory.
have no idea because
Right.
we can't study it in live brains,
Right.
although we're developing ways.
Yeah, maybe within your lifetime that may happen.
When I left the lab, they were getting close.
So we have the SSRIs and other medications, and they're constantly coming out with more. So those are great. But there's also therapies like cognitive behavioral therapy that have proven very, very effective in the treatment of many, many psychological conditions, including depression. But when you combine therapy and medication, you really get something going.
Yes. you
And
do.
there's my soapbox.
Yeah.
Yeah, I'll get down now.
Actually, the psychiatrist who taught my psychopharmacology class, his number is it's 60% therapy and 40% medicine.
Yeah. And I think that we also can't, we can't ignore things like lifestyle. So exercise, diet, how's your sleep hygiene? You know, what are you doing to regulate your sleep? All of those play crucial roles in managing depression.
I mean, those are foundational.
Yeah.
Those are what I would call in the therapy world your vital signs.
Yeah.
Right?
We absolutely know that regular physical activity and healthy eating can significantly reduce symptoms of depression and other mental conditions, and those things support mental well-being. And speaking of support, right? Your support system.
Oh, huge.
Yeah, yeah. So support from your friends, support from your family, support from mental health professionals. It can be a vital thing in strategizing against depression.
Right.
There are support groups now. The good news is, and this has come along with COVID. It's been one of the blessings of COVID in a way. There's more and more activity that you can join in online now.
Right.
That weren't available before.
We're a much more connected world.
Yeah. So support groups, online communities, all of those are valuable resources for anyone struggling with depression. Because one of the things, that is so important is that you realize, you connect, even though you may not feel like it, you connect and you begin to realize, oh, I'm not alone. I'm not fighting this by myself.
Right.
Yeah. And so that connection, just that connection, can be massive in treating depression.
Knowing that I'm not alone and that there's others out there that can support me along the way.
Yep, definitely. We're talking depression today, not because necessarily just it makes us all happy, but the awareness and the understanding of depression are critical for a supportive environment for any of us that are affected. And if you love someone that you think is depressed, what do you do? Well, we'll come back and talk about that some more here on Strategies. We'll be right back.
Hi, this is Jay Merle for Pintail Roofing. Let's talk about quality. When you hire Pintail to build your roof, here's what you can expect. Quality and quality control are the most important concerns for us at Pintail, and you need to know that Pintail stands tall with swift and professional performance on any warranty call. This is our most important policy. And remember, we're your neighbors. We'll be here for you for the long haul. Our family's lived here for over 100 years, and we aren't going anywhere. On the commercial side of Pintail's business, our fluid-applied roofing solutions can save thousands of dollars over conventional commercial roofing options. Call Pintail at 226-ROOF for a free inspection of your home or commercial building. That's 226-7663. Pintail Roofing. What's the condition of your roof?
And welcome back. Welcome back into Strategies for Living. We do healthy here. We do peace. We're questing for a better life for all of us right here on Strategies for Living. We're talking depression today. Lauren Leon McMillan, David McMillan. The awareness and the understanding of depression. It's so prevalent. 21 million Americans every year suffer from depression. 8% of our population and 15% of our population 12 to 17. I mean, we're talking 3.7 million young developing minds, brains, individuals. That's significant. That's why we have to talk about this stuff.
Yes.
And so, I can't emphasize enough, Lauren, and I know, I think I'm speaking for both of us when I say, supporting people with depression. Of course, you have to be aware of what we're talking about this evening. That's why we're talking about it. But the understanding, being able to understand the signs, the symptoms, impacts, empathy. You know, it wasn't long ago that a lot of people who might have been depressed, might have had to deal with someone in their family, let's say, that said, yeah, you just need to get over it.
Mm-hmm.
Yeah.
Just go for a walk. Just just do that.
You just need to
Just
pray.
be
You
happy.
ain't in church, buddy. You need to be in church. Okay, well,
Okay, maybe.
But you can go to church.
But we're past that at that point.
Yeah,
at that point, the
yeah.
knock is real loud.
That's exactly right. So, once we understand the signs and the symptoms and the impact, then that's going to give us empathy, and that really is the foundation of effective support and what's needed. I think we have to reduce the stigma.
Yeah.
I think we've made headway here.
Yeah.
I don't think we're home free yet, but I think we are making headway. The public education and having open conversations. I mean, we're talking about this on talk radio, for
Right.
goodness sake.
Right.
This is an open conversation. We have to do more of these kinds of conversations about mental health conditions like depression. Those are crucial for understanding, the stigma that has for so long surrounded mental health, right?
Right.
It's fascinating to me that, if someone shows the signs and the symptoms of a heart attack,
Right.
they clutch their chest, or they say their arm is hurting, or those other, there's an elephant on my chest, those types of things. We immediately rush to them, right? But when someone shares the signs and symptoms of depression, many times people run away.
Yeah.
Yeah.
Yeah. Isn't that crazy?
It is.
But it also is kind of a loud acknowledgement of how much we need this emotional intelligence piece within the society.
Yeah.
We're afraid of what we don't understand and what we don't know.
Yeah.
And I hope that's part of our mission here, is to bring some more understanding, to bring more awareness.
Absolutely. I'm going to ask you, again, one of the reasons we do these conversations is maybe there's somebody out there, maybe there are some bodies out there that haven't considered yet, I could be, they've touched on this, and that sounds like me. They've touched on that, and that sounds like me. I wonder if I'm depressed. I wonder if I'm actually clinically depressed. How important, Lauren, is early intervention?
Couldn't be more important. I mean, as early as soon as you are aware, or even have the question or the thought pops into your mind.
The possibility exists in your mind.
Yeah.
I could be depressed.
Right. It's important to act on it because, as we've mentioned, it's a knock and it only gets louder.
Yeah.
And so as early as you can get in to, see someone, whether that's a psychiatrist or psychologist, or, finding a local community church leader who can get you connected with who you need and what you need at that point in time, it's important.
If you have a family physician, I would encourage a family physician that you trust and that you rely upon. It's over the years that I practiced, it was my observation that family docs, even though a lot of them don't treat depression themselves, some of them will.
Right.
It's really a comfort thing of their level of comfort. Many of them will tell you, yes, I'll help you with the medication if you will go find a good mental health counselor to work with me. Yeah. I love those physicians. But if you have a connection with a good family doctor, personal physician, that may be a very good place to start.
Yeah, that's a good point. Absolutely.
The other great place to start, we have so many wonderful licensed mental health professionals in our community.
Yes, we do.
And just use Google. Many times Google will take you to Psychology Today, which over the years has built in every community quite a quite the summary and listing of licensed professional counselors, psychologists, licensed clinical social workers, people who are on the front lines of dealing with depression,
Yes.
right?
Yes.
And so make that connection. Sometimes that call may be the most important call that you make all year.
Yes, it
Yeah.
can. Absolutely.
So, but I think that the earlier you intervene, I will say it this way: the longer you let it go, the more challenging sometimes the treatments will be. You got to.
Well, because what happens is this piles on that, and you have to do more and more excavating.
Yeah.
Is really what it turns out to be.
Right. So I mean, it's the awareness and the understanding are really critical, and the support. If you know someone, or you think you're hearing this and you think, oh, they're talking about so and so,
Right.
my friend or family member. I can't underscore.
Start a conversation.
Yeah.
It's important to ask.
Yeah, it may
With
be
sincerity.
uncomfortable at first, but it may be one of the most important conversations that you could have with that individual.
Yeah.
Sometimes just reaching out and the person knows, somebody is looking, somebody sees me.
Yeah, it's validating.
And that's validating, and that can be so important in the treatment of depression. We're talking about depression. It's a pervasive mental health issue that affects 21 million Americans every year, and 3.7 million young people, 12 to 17. It's important that we understand it and know about it. We're tackling it today here on Strategies for Living, and we'll be right back. Hey, let's talk about the Robinson Film Center. I say it a lot. There's no place like the Robinson.
Absolutely, there is not.
617 Texas Street, downtown Shreveport. You've got so much. You got the movies. You got Abby Singer's Bistro on the second floor of RFC, open for lunch and dinner Tuesday through Saturday.
Newly remodeled.
Absolutely. Great menu. RobinsonFilmCenter.org is the way you check it all out. You can go to RobinsonFilmCenter.org at any time and find out what movies are showing. Here's the deal. You want to join the crowd, join the fun, become a member. When you become a member, you become a star. You get discounts on movies, you get concession upgrades, you get bistro deals. RFC, 617 Texas Street in downtown Shreveport. I'll say it again. There's no place like the Robinson.
There is not, and I'm glad we have one right here.
Absolutely. The RobinsonFilmCenter.org.
Reading begins not in the classroom, but in your child's brain. I'm Donisa Walker with LearningRx Shreveport. If your child struggles to read, maybe he or she has trouble focusing or comprehending, LearningRx Shreveport offers a science solution to reading problems, working one-on-one with your child, targeting his or her reading skills. Today, call LearningRx Shreveport. Make an appointment to have your child assessed. I know you want to help your child, so does LearningRx Shreveport.
And welcome back to Strategies for Living with Lauren, David. So, depression, it is pervasive. It's a mental health issue that affects millions across the world, rooted in complex biological, psychological, and environmental factors, and has a profound effect on our society.
Yes, it does.
And so it's important that we talk about it. Awareness is so important. Understanding depression is crucial for reducing the stigma and supporting anyone who is affected with depression.
Being able to recognize it in yourself and in others, recognize, be aware of your body and your mind, and if you notice these changes, it's a call to action.
Right.
It's a call to, hey, we need more support than what we're currently doing. There needs to be a change. And if we're not aware of what the change needs to be, we need to seek out resources, and we have so many of them.
Absolutely. And, and it's really about empathy. It's about early interventions. Empathy and early interventions of people who support us and are around us, really, those are the best outcomes. Those outcomes are much better than someone feeling like they're isolated and alone.
Right, because what tends to happen is if you don't get help, it's kind of an internal message to yourself that, you don't care. And it starts this cycle of depression, and now I'm depressed because I'm depressed, right?
Yeah.
And that can be a hard place to get out of. I mean, it's definitely possible.
Awareness is a powerful tool in the whole battle. It's about reducing stigma. It's about understanding. And that's why we talk about it here on Strategies for Living. It's important. Folks, thank you. Thank you for tuning in to Strategies for Living. We appreciate you being here with us each and every day. And we appreciate our sponsors making it possible. The Robinson Film Center and Azalea Cleaners and Learning RX and Pintail Roofing. And the Balanced Life Wellness Center. If today were the last day of your life, you only had one more phone call that you could make, who would you call? What would you say? And why are you waiting? Make the call. For Lauren Leon McMillan, I'm David McMillan. See you next time, right here on Strategies for Living.